I'd like to welcome everyone. We appreciate our continuing webinar series through the BART Foundation. Tonight, the BART Foundation presents a presentation around alternative therapies for brain injuries. Tonight, we're going to explore the topic of suicide prevention, treating and healing brain wounds with Dr. Robert L. Beckman, PhD, the co-founder and executive director of Treat Now. Additionally, joining us to help moderate is Joel Goldstein, a parent of a TBI survivor, author of No Stone Unturned, and the executive director of the BART Foundation. Just a few housekeeping items. The webinar is being recorded, so if there's questions that do come up, people would like to share afterwards, the video will be published on YouTube, will be published on the bartfoundation.org, and follow-up emails as well, so do look out for that. Don't hesitate to submit questions throughout as well. If you're familiar or not familiar with Zoom, there's a Q&A button at the bottom. You can submit questions throughout, but we'll also explicitly ask at the end as well and leave some time for open discussion. So if anyone has questions, don't hesitate to submit. Joel and I will be reviewing and moderating them at the end. I'd like to formally introduce Dr. Beckman. Dr. Beckman is one of the founding members of Treat Now, a pro bono coalition formed to end service member suicides. He has spent over 16 years helping heal brain wounds by proving the safety and efficacy of HBOT, or hyperbaric oxygen therapy. Tonight, with other functional medicine interventions, the Treat Now coalition treats brain wounded warriors and others with TBI, PTSD, and post-concussive syndrome, leading to over 31,000 successes in over 150 clinics in the US. We appreciate you joining us, Dr. Beckman or Rob, and we're really looking forward to it, and we appreciate the time you take to speak to us tonight.
Thank you, Brian, and thank you, Joel, for having me here. As you can see from the initial slide here, our motto mantra is heal brain, stop suicides, restore lives. I'm going to explore all that we've done in the last 16 and a half years to work with basically nothing, a coalition of veterans, much like myself, pro bono. In 2008, suicide rate was starting to go up. Reports on absolutely treacherous behavior out at Walter Reed, and I and several others got involved. And so for the last 16 years, we've been asking the question, how can we reverse suicides? Well, the bottom line up front, that's an old Army term, the bluff. We know how to heal brain wounds. We know that hyperbaric oxygen is safe, effective, low cost, and available. Sadly, DOD, the VA, services, medicine in general, are just ignoring the science. We're going to change medicine by focusing on brain wounding. That's not a phrase that you see in medical textbooks. People resist, but it's clear when the brain is concussed, especially with unconsciousness and projectile penetrating, it's a brain wound. So part of our job is educating decision makers from the White House all the way down to the State House. Our end goal, and this is important, it needs to be on label at the FDA and CMS, insured and widely available inside and outside DOD. The private sector stands ready, and I can tell you from the commercial sector, there are 2 to 3 new clinics for hyperbarics used both on label and off label, opening every week. That's week. It's just amazing, the surge. So I want you to know some important numbers. By the way, this PowerPoint slide is on the website. You'll see at the end a pointer to all of this. So don't worry about memorizing the numbers. There's no test, but we've got a suicide epidemic. We know that since post 9/11, there's at least double what the VA maintains, or the number of TBIs and brain wounds. They don't use that phrase. They would rather use PTSD, make it a mental health problem, and thus subject it to psychiatric drugs, talk therapy. Suicides, we know, are over 151,000. You'll see a chart. Veteran opioid deaths, this is carnage, and it continues. Many of those drugs, by the way, warn of suicidal ideation in males between the ages of 17 and 25. It's a catastrophic, not just mismanagement, but we believe medical malpractice suit waiting to happen, the way in which they force veterans into a psychiatric routine and then feed them death pills. Along with doing all of our work with hyperbarics, which, by the way, I'm not dedicated to hyperbarics. We make no money. We own nothing. We are dedicated to stopping suicides. But when you get a diabetic foot ulcer and then an amputation, it's kind of a death sentence within 3 to 5 years because they've waited too long. And you look at that number of nearly 800,000 exceeds KIA since the start of World War I. We've had 31,000 successes doing this, 6,000 veterans, 600 special ops, more and more spec ops warriors are offing themselves, succumbing. There's worldwide peer-reviewed clinical trials, thousands of papers on how effective this is. You'll see the variety of ways in which it's used. We've got 10 states that have passed legislation, $32 million plus, dedicated to HBOT for TBI. Oklahoma started it off, Virginia was the latest, and Kentucky just put $1.5 million in over 2 years. And we've got several other states writing legislation. Joel can talk to you about the New York stuff. But here's a bottom line figure. Economically, we've tried the moral argument, we've tried the readiness argument, we've tried the morale argument, the moral argument, and economics. We hope will make a difference, but it's going to cost $4.7 trillion to not heal those brain wounds. That's $181 billion every year to not treat and heal. Just look at the VA's own numbers. We got these through a FOIA via Congress office. The number on the chart is 146,000. These are their numbers, but officially on their website, you'd think it was 40 to 50,000, but these are their official numbers. They declare VA and DOD that suicide prevention is their number one clinical priority. You certainly wouldn't know it from results, but from budgets, 20% a year going into suicide prevention strategies, zero, focus on healing brain wounds. It's about symptomatology and collaboration and communication, and now using AI to screen scrape and find out anybody in their system who's even investigating the word suicide. And gun safety, and it goes on with not treating and healing brain wounds. It's execrable. So what is traumatic brain injury? Signature wound, you've heard of it. That's the last time you ever hear of the word wound used in relation to brain injuries. They talk about mental health issues a lot and injuries. What's a blast? Some of you may have experienced blasts. We know through copious research over the last 20 years that blast injuries are devastating, not just to the brain, but to a whole host of other body systems. And one of the things that we learn about this blast wave is that within milliseconds, and especially if you're inside a vehicle, the ricochet effect, you can get 6 brain-altering blast waves. It's just astonishing what it does, not just to the brain, but to all body systems, especially the heart and the lungs and the adrenals and so forth. A difficulty for us is there's no evidence. All of this use of imaging to try and see if there's a concussion or a traumatic brain injury, in most cases, it shows nothing unless there's a brain bleed. certainly a Friday night football accident or soccer or lacrosse or whatever isn't going to show on a CAT scan or an X-ray, MRI, etc. fMRI and some of the more exotic diffusion tensor imaging can show some brain mass stuff, but by and large, all of the imaging is a waste of money. It's not going to show a concussion. But one thing we know is that this thing you've heard about before, a chronic traumatic encephalopathy, huge damage over time, research inside the army and around the world, Israel, Russia, etc., showing results that mimic what Anne McKee is finding up in Boston about brain damage from football players looked at after death. But for us, it's not invisible because um, they're visible when you use the right technology. And some of the technologies that we're using, including diffusion tensor imaging, can show actual brain matter, and a QEEG and multiple other tests, much better than trying to image the brain, show functional results, which can show diminished capacity, and then after HBOT and even during, show transformation, growth, and health. So there's, to back up, there's a healthy brain, there's a brain after an injury. The damage can last virtually forever. One thing we know is that there are brain cells which are killed, but a huge mass of the brain is stunned and put into idling mode, and HBOT wakes that all up. I'm dramatically abbreviating this slide presentation on blast injury and the role of HBOT, but one of the things we have learned, and the Army reinforced it, is that PTSD in a combat veteran is in all likelihood a secondary effect of an underlying brain damage. So whether it's from a blast, a fall, firing your own weapon, a variety of ways in which the head is damaged, parachutists and training accidents, breaching, firing your own heavy artillery and tank busting weapons, etc., shocking, blasting, and injuring. And the net is that the function of the brain now damaged is impeded, and thus all that comes from, you've heard it before, the labels of CTE, TBI, PCS, PTSD, and all of the sequelae, the symptomatology, which is the way that most people treat brain injury, treat the symptoms, not the underlying damage. Clinical practice guidelines, sadly, are written by the very people who deny that HBOT works. And so the clinical practice guidelines say HBOT is unsafe, unproven, risky, expensive, and you don't want to do that. We've got psychiatrists and others in the system who have threatened veterans with losing their benefits if they try HBOT and it works, even though, of course, it doesn't work. So all of this symptomatology, you'll see here, the conundrum that a diagnostician has in listening to the symptomatology, and whether this all these symptoms come from one blast or multiple blasts over time. It's interesting that there's no baseline that can be taken on a soldier prior to combat that's worth a damn, because the baseline may be reduced by guys like me who played football in college and came pre-damaged. And so operating from a lower baseline, you're not going to see all that has happened. And even when they've been instructed by Congress to run tests both before and after, it's honored typically before being shipped out, and not even 50% of them coming home get tested. And one thing that anybody in this business learns is that there isn't a warrior alive who wants to be pulled out of combat and suffer the loss of security clearances and a job just because they've got a buzz in their head. And so the vast majority of combat veterans and special ops, especially, absolutely ignore the effects except to take pills. The trifecta, which is common for everyone, is a pill to sleep, a pill for pain, and a pill for vigilance. They call it the M&Ms, and it's just astonishing the number of legalized drugs which are handed out to deal and cope nonstop. And so whether it's TBI or PTSD or ringing in the ears or all of the symptomatology that most of you are familiar with, the brain is damaged, the centers of control, executive function, they're damaged, and the wiring is never going to come back in some cases. The breakage, the twisting and shearing capability is lost, along with the ability to even know how badly damaged you are. One thing about HBOT, moving into how do we treat and where did it come from? It's got a 300-year history. We know that it's safe and effective. The government held a conference in 2008 in which they all admitted it's safe. The Navy and the Air Force have written the books on safety, on all of this, and effectiveness. The FDA approved the use of HBOT in 15 different instances. It's on label, safe and effective, used in a rich variety of ways, on label, insured, etc., worldwide. And then all of these other alternative uses, off label, so to speak, available in hospitals and clinics all over the US and the world. In simple terms, any increase in oxygen concentration above 21% or pressurization above sea level is medicine. Any increase in oxygen concentration or pressurization is medicine. Thus, very, very difficult to run a randomized controlled trial other than to have a control group that doesn't get treated and then treat the first group and then treat the second group and do the comparisons. There's a huge literature on how corrupt the science has been in hyperbarics for traumatic brain injury. All of that's on label. So the on-label uses of HBOT are listed here. There's massive amounts of literature on why it's good for air embolism, diving, burns, arterial insufficiency, non-healing wounds. I mean, that's diabetic foot ulcers. Sadly, the VA has no chambers in the system, none. And you saw the numbers, almost 800,000 amputations that have led to death within 3 to 5 years. It's a death sentence to wait too long on diabetic foot ulcers. These 4, by the way, air or gas embolism, decompression sickness, carbon monoxide poisoning, and intracranial abscess, are all brain wounds. And thus, we maintain that HBOT is already on label because of its close proximity to those things which are already approved. Listing here is just a few of the uses off label, so to speak. We call it modern HBOT. This list is about 1/4 of all the uses that HBOT has been used for. It's astonishing in the world of autism how much work has been done in the successes. The COVID, the research continues worldwide on long haul COVID. Even in the first 2 weeks of the pandemic, some of you heard about that meat factory in Nebraska. Well, right across the border in Iowa was a clinic treating the affected with hyperbarics, and anyone who got hyperbarics got out of the ICU or stayed out of the ICU. I mean, when you think about long haul COVID at base, it's hypoxia, can't breathe. So stick a tube down your throat or breathe oxygen under pressure. It's magnificent for getting on top of long haul COVID. Not all, but most of the symptoms related to oxygen transfer. The science, again, most of the people who get into HBOT are at pressures of 1.5 to 2 atmospheres. Just think of going 30 to 40 feet underwater, a bath of oxygen 100% or a mask to breathe. And net is 7 to 12 times the normal supply of oxygen. And all of the inflammation that comes about with brain injury is bypassed until the inflammation is under control. HBOT, just for reference, is first and foremost an anti-inflammatory, and then growing new blood vessels, new neuronic tissue, and importantly, stimulating the growth of the body's own stem cells, somewhere between 8 and 20 times the number of stem cells who, strangely enough, know where to go and what to do. Here's a normal oxygen breathing, the little white bubbles in the bloodstream. When you have vascular and neurologic damage, there's ripping and tearing down at the micro level and thus reduced oxygen. So you have this double whammy of inflammation, body's natural response to insult, plus reduced oxygen. And what do you think is going to happen? People get hypoxic, can't think, can't remember, can't function, etc. When you repair and revascularize and then pump up to 20 times the amount of oxygen, that's called healing. Every wound clinic on the planet understands to heal a wound, you need energy and oxygen. Why wouldn't we put more oxygen into the mix? Well, here's some of the top indicators of success, i.e., the transformation of the patient from no dives to 40 to 60 to 80. Suicidal ideation is diminished or ceases. Remember, we're in the business of suicidal prevention. And when I got started, I hadn't even thought about hyperbarics, but it absolutely slams suicidal ideation because it's restoring function and, importantly, hope. But headaches go down, all of the violence and depression, mood swings, impulsivity. I'll tell you, one of the first indicators of transformation is sleep. Sleep deprivation is torture, and virtually every combat vet with TBI has a sleep pattern that is suicidal. It's the damnedest thing. They cannot sleep, snatches here and there. And the reports after somewhere between 1 and 5 dives, 12 to 15 hours of sleep every night. It's the damnedest thing. It just happens. We expect it, but we don't promise it. Okay, we got that one again. Let's go to the next slide. All right, this was fascinating in my research. About 10 years ago, I found the textbook of military medicine, 1990. And if you'll notice the orange square, hard to read, but the definitive therapy for blast exposure is hyperbaric oxygen, 1990. This is still published in textbooks, and the Army and the VA and the NICO, the Intrepid Spirit Centers, and medicine in general ignore their own recommendations. Ignore. Amazing stuff. Here's our clinics consortium around the country. They're all voluntary. It's free to join as long as you've got medical grade chambers, and we keep pretty close watch on safety, security, a variety of protocols. Safety is first. The absolute scurrilous accusation that HBOT puts veterans at risk is a palpable lie. It is a lie because it has been disproven even by the services themselves. It's safe. You can kill somebody in a hyperbaric chamber if you try hard, but you follow the protocol, safe as all get out. We have had, by the way, one suicide after a full treatment with hyperbarics. A Navy SEAL drowned himself a couple of years ago. He had a lot of other problems. One suicide out of hundreds of thousands of treatments. And remember, we're north of 151,000 in the VA system. So we've got 159 clinics I counted today. General Pat Maney, an amazing guy. He was the first veteran treated with HBOT. He'd gone over to Afghanistan to work on their legal system, was blown up, evac to Walter Reed, and through the graces of Marty Hoffman, my colleague and founder of HBOT with me, or of Treat Now, Marty got him down to George Washington University, pulled him out of Walter Reed, got him HBOT. And Pat Maney today is a legislator in Florida, retired from the bench. His life was over, both as a military man and a judge. He's retired from the judiciary. He's a legislator in Florida, got $28 million and law passed in Florida for treating veterans with HBOT. A magnificent man and a phenomenal example of what's possible. That's just one of literally tens of thousands of successes.
If I went to heaven tomorrow,
I don't know
want all
what just
diabetics,
happened.
including you, to know
I
about
gotta
it. Fed up
kill
with
something.
headaches,
Stand
blurred
by.
vision, and running.
Stand by. I don't know what I hit, but I'm gonna bring it back up. If you're still there, I've got to find. Stand by with me for a second. Don't know what I did. Oh, here we go.
There we
I
go.
hit something. Sorry about that. Don't know what I hit, but that's one man's story. He is available. He has, by the way, helped foster what are called veterans courts all over the country, where a veteran who's been a combat veteran is first appraised for underlying or undiagnosed brain injury, and a whole different path goes forward. And we get them into hyperbarics, and they avoid jail in most of the cases. It's a terrific program. I bring up this slide, preventable suicides. Just read down that list. Mike Webster was the first professional football player diagnosed. He was a subject of a phenomenal video by Frontline. And what was it called? The League of Denial. Bennett Amalu, the subject of the movie Concussion with Will Smith, found CTE in his brain, and that started a long process that now has found the latest count, I believe, is 341 out of 356 examined brains out of Boston. Greater than 98% of the brains that they've done work on showed CTE. But if you look at this, I mean, it doesn't respect age, gender, sport. This is just a sampling. NC2A athletes dead of suicide found with CTE. The youngest kid, 14, with CTE. So, and the last one there is, of course, Matthew Leivelsberger, Green Beret, Las Vegas, Tesla explosion. His lady friend and nurse knows that he had brain injury. And I'm telling you, these guys will not talk about it until after they retire, because they'll lose their security clearance and their livelihood, and they don't want that. This list, by the way, you can go in and Google CTE suicide. You'll be staggered around the world, all the reporting. So what's next? We need to get public and governmental awareness of this safe, effective, immediately available. It's ready now. We're using it. People are not just surviving, they're thriving. They get their lives back. Some of the videos online you got to listen to the wives talk about before and after. By the way, that's another aspect of this. Secondary TBI in combat vets with TBI untreated. The Elizabeth Dole Foundation did a major study with the RAND Corporation, and the number of TBIs in wives and caregivers is staggering, staggering. And the effect on the families, it's horrible. So we've got to raise funds. We're all pro bono. We raise the money. We work with foundations to get vets into treatment. So part of raising consciousness, more legislation in more states, more national legislation demanding VA and DOD even talk about the availability of the treatment. They won't even tell vets with DFUs that's on label, insured, and widely available. They don't even tell. 93% of vets with amputations have never heard HBOT exists. And surprisingly, you'll find in all kinds of places. Diabetic foot ulcers go untreated with HBOT because people don't even know. Just this morning, a group of 30 plus doctors in New York who are HBOT specialists in wound care centers were uniformly ignorant. These are MDs with HBOT certification, ignorant of the use of HBOT for traumatic brain injury and the clinical trials and recorded peer-reviewed research. They knew nothing about it. We're up against some short attention spans. We have tried to convince Congress to spend more of the drug budget to treat and heal. That hasn't gone anywhere yet. But we've got to change medicine and brain wound healing. The principles are set. It's all of our jobs. Everybody listening to this knows somebody with a brain injury that hasn't been treated properly, whether from a car accident, a fall, et cetera, et cetera. Here are the sites that you can go to. I put together a folder in the knowledge base called webinar. All the documents I talked about are in there. It's a library full, the website and the knowledge base. And all of those videos, I've got it posted there on YouTube. You'll see hundreds of videos of success stories and trial and tribulations of trying to get help through the VA. And I think that's the final slide. So we're back to Brian and Joel.
I really appreciate it, Rob. We appreciate the information. The depth of your expertise is not lost. So we do have a few questions. And the first I'm going to try, there's a lot of context, and I think I'm paraphrasing it correctly, but essentially the spirit is a gentleman that is a veteran, and he's mentioning that he feels that some of his peers could actually be part of the problem of the unadoption to HBOT, and that he feels it difficult in the sale of enlightening other vets about the time obligation of being worth. And if there's any context or experience you can share on that education gap.
Tell me, Brian, how I get back to viewing you all. What do I kick? Video?
Yeah, you can
No.
close out the share screen. There should be a button on the bottom.
Share screen. Let's see. Advanced sharing options. One participant can share. Can I share? Kill? I don't see a kill button on share screen. Share. Well, I'll just go. Maybe I can kill that. I'd love to come back and see y'all, but it looks like it's not going to happen. So let's just talk through. The question, remind me again, people standing in the way. Yes.
On the combat side, the gentleman identifies himself as a veteran, and he's saying that he feels that some of the unadoption from other peers and veterans is around the hard sale of enlightening them of just the time obligation that the investment is being worth it.
Oh, interesting question. Let's see. Okay, I got you two back up at least. That's great.
We
Um,
see a calculator on your screen, so I don't know if you want to, if there's a way to just click the zoom icon on the bottom to kill we just see your desktop.
um, I'm trying to kill. I can see you all. What are you seeing from me? Just my face
Just
now or no?
your desktop, you're still sharing your screen.
Okay,
It's not the end,
I
not
don't
the
know
end of the
how to
world.
stop sharing my screen. That's my question. There's share, and I'm trying via share to stop sharing. Um, don't know how to kill.
Yeah,
There's
there
no
should be just
button.
a floating button that's just kind of end share screen.
I wish I could see it. I don't want to leave. So let me just answer the question. Um,
Mhm.
it's a commitment. I was on the phone today with a woman who's mated to a former Canadian hockey player, pro. He's 44 years old and he absolutely knows he needs help, but he refuses to accept help because I'll just soldier on this way. We've got him in touch now with a wrestler and another hockey player. We're going to try and talk him into the program. He doesn't know that he wants to commit for 40 dives. It's a commitment. It's a 2-month protocol. Dive once a day, sometimes twice a day with certain vets. We do um, dive twice a day, and we can get them through in 1 month. 40 dives, typically 60 to 90 minutes, depending. The cost for those we treat is either free or very low cost. We've got tons of foundations who help us defray those costs. Travel, housing, per diem, all of that has to be attended to. Um, so yes, it is a commitment, and it typically takes a caregiver, someone to help them make the decision. Some are too far gone to even get in the car and go, so they have to have a caregiver. But the bulk of the veterans and citizens that we treat drive themselves back and forth to the clinic, and within 20 dives, the results are just manifest. And by the end of 40 dives, we test before and after. The results are uniformly positive. I mean, they quite literally get their old selves back, not a new normal, but their old normal, which is what we like. So I can't say enough about the need for a caregiver, a friend, a partner to hold the hand of the person to get them started into treatment. And we're here to help match people, primarily veterans, but after 16 years, we've helped thousands of citizens who call us, find us in desperation. And I should mention, apropos of the question, there are many, 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 I'd say probably half of brain injured victims who make a pact with their injury, and they become codependent with that injury, and they settle in. They get their benefits and their disability, and they don't want to disturb anything. That's a tough one.
Um, Rob, can you hear me?
Yeah, go ahead, Joel.
Okay, well, I had a question relating to much of this. How long post-injury does it still pay to do HBOT? I mean, obviously, the recent wars in Afghanistan and Iraq, but what about veterans, or for that matter, football players who were injured, in Vietnam or Korea? Does it still help them?
Well, short answer is absolutely. On our website, there's Medal of Honor winner Sammy Davis. All of you know him through the movie Forrest Gump. That scene with Tom Hanks getting the Medal of Honor from Johnson is Sammy Davis. They just superimposed his face. Sammy Davis won the medal, was awarded the medal, excuse me, in 69 for injuries in 68. And he came to us, if you can believe this, in 2014. So think of the time, 32 and 14 is 46 years of suffering, gradual decline. He was a whole host of degenerations. And Sammy Davis now, according to Dixie, his wife, watch the video. You won't believe it. It's like he's 40 years old again, out giving speeches. He gives 200 speeches a year, talking to anybody and everybody about the need to help veterans and HBOT. So we've got pro ball players all the way back. You'll recognize some of the names. Joe Namath is the golden boy. He had 120 dives when I first met him. It was terrible. And some of you have seen his new career, advertising and talking and carrying on. It's like he was 40 years old again. So don't delay, get in, there's help.
A follow-up question. You've mentioned and shown on some of your slides some of the conditions that it helps heal. Are there any counterindications? Are there any conditions that would preclude a soldier or a civilian, for that matter, from taking HBOT for brain injuries?
Well, I'm just going to tell you, it's that there, under no circumstances should anybody say it's 100% safe. It's not 100% safe because people screw up all the time. There's non-medical grade chambers is just an example. Bag chambers, canvas chambers. You see them a lot in chiropractors' offices, in wellness centers, and so forth. And the level of safety is just abysmal in too many cases. No doctor present. They leave the room and so forth. So hyperbarics has gotten a bad name when these bag chambers, non-medical grade, explode. People with emphysema, pulmonary problems, pregnant women, the counterindications are all laid out in advance. So nobody with the problems that are well known should get into a chamber. However, the vast majority of people who come to us get into HBOT. The vast majority, I'd say 98%.
And would you say of the 98% who get in the chambers, what percent are significantly healed and conditioned and their symptoms relieved?
Our success rate advertised is 85%, actual 97%. Improvement.
Yeah.
Those measures of improvement are documented in peer-reviewed research worldwide. Nobody is made perfect again, period. The amount of damage done by a blast at 10,000 feet after you've jumped out of an airplane with a 120-pound pack, you're crushing your skeleton and then you get blown up. And then you breathe toxic air, burn pit effluvium. I can go on with what the battlefield does to you with or without brain injury, but nobody is made perfect. The number of people who get their lives back, save their marriages, make friends with their kids, keep their jobs, or start working again, very high.
I'll just interject, if I may, briefly about our son, Bart. He was involved in a catastrophic auto accident when he was 16. He was a passenger. And after about 9 months in hospital, he had significant brain surgery the night of the accident. All kinds of rehab was offered and given. But the advice of his rehab hospital, a very reputable one, Helen Hayes Hospital in downstate New York, was that he should just be placed in a nursing home or a convalescent home where he would remain for the rest of his life. in desperation, his mother and I were lucky and found out about HBOT. We got him some dives, and fast forward, say, 20 years later, if you had met him 20 years later, most people didn't even know that he had an accident or that he had a brain injury. If you
Wow.
spent a long time with him, you might find yourself saying, well, geez, didn't I tell this guy I'm not a Yankee fan? Because, his working memory was a little sketchy, but he held down a job. He made lots of friends. And some of you may know that he passed away from unrelated, more from issues with struggling with COVID and alcohol. He passed away, but when he passed away, 500 plus people attended the memorial. 500. How many of us? I mean, he wasn't a politician. He was an ordinary person. He made a very robust recovery. I would say a near miraculous recovery, entirely as a result of, he took about 120 dives initially, and then he would periodically take refreshers. So he took over 200 dives and was continuing to make progress, marginal progress, always. So, sure. I'll also just kick in here. New York State has a bill, thanks to Treat Now. We've got a bill in front of the health committees. Amy Paulin's committee. I don't have the number of the bill, but she is the chairperson of the Assembly Health Committee. If you live in New York, please let your assemblyman and your senator, and if you know somebody in the executive offices, the governor's office, know that you enthusiastically support this bill, because this bill will create a pilot program offering brain-injured New York State veterans HBOT. And it'll be carefully controlled and studied, results published, and it will add to the body of knowledge, which is already vast. I mean, Rob, you didn't explicitly mention, but in some very progressive countries, I mean progressive medically, not necessarily politically, like Israel, HBOT is part of the standard of treatment and has been for a decade or so, because they've done the studies, they've done the side-by-side comparisons, and they've shown that for brain injury, stroke, a whole host of anoxic events, and now more broadly, even the things like dementia, HBOT seems to really do the trick there. And you don't need any special scripts to get it. You just go to your doctor. So that's the direction we want to move here. New York State wants to do its part. And so I want to do that little political pitch. Has anyone else got any questions?
Yep. We do have some other questions.
Okay.
Sure. One says, with most HBOT science being 1.5 ATA, would the US made home chambers be effective even though they top off at 1.3?
Well, again, medical grade chambers dive typically to 3 atmospheres of pressure. The so-called bag chambers or canvas chambers or low pressure chambers are approved only for air sickness. Up on the top of Everest, you see chambers with oxygen bottles pressurized to 1.3, and what do you think? They get their brains back. What's the antidote for altitude sickness? Get lower pressure, or as it were, get lower on the mountain and higher pressure. But for brain injury, it's a long slog, and we don't recommend it. It's not bad. If that's all you've got, go for it. Air compressors are producing close to 95% pure oxygen. And there are now bag chambers made in Poland and Peru, certified to 2.0 atmospheres. These are portable, canvas, mobile chambers. So the industry is evolving. but we recommend 1.5 to 2.0.
Appreciate that. We do have a second question, definitely moving on topics, but asks what are the reasons given by the VA and DoD for not promoting HBOT for TBI? Are there any reasons thus far the FDA for not approving it for TBI?
Two separate questions. Anybody who's interested in all of the excuses that have been put forward can read on that website in the folder webinar a paper. It's called The Obvious Question. Since it works, why aren't they using it? And we've kept that going for about 12 years. There are 17 reasons. A big one, obviously, is Big Pharma. The billions of dollars dispensing pills to veterans is a market that we're going to reduce by close to 100% on some of the drugs. But the research community, another gargantuan industry. I had no idea how many tens of thousands of mental health clinics there are in the US. The recidivism rate is 90%. It's a gargantuan industry of treating this as a mental health issue instead of a brain wound. It's the damnedest thing. It's not taught in medical schools. The number of doctors who've never heard the word hyperbaric, it just is staggering to us. But the VA did 4 studies, all of which were queered by their misuse of the laws of physics and biochemistry and physiology, declaring that the control group was not getting medicine when in fact they were. So their results showed everybody got better. We can't ignore the results, but because the P factor was not broad enough, we can't recommend it. It's unproven. We need more studies. Surprise, surprise. So I can go on and on with the excuses which have been given about risk. It's the damnedest thing. They are killing people almost willfully, handing out these pills in 180-day doses, gunny sacks full of drugs that these vets come to us with. But we're the ones who are risking soldiers' lives. The testimony there on the website that the VA put last year almost duplicated the testimony they gave 10 years earlier. They don't want this. And there are 17 reasons why they don't want this. I can go on, and we do in print. The major one, I suppose, is medicine is very, 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 very stultified, reified, conservative, and doesn't want to change what it already knows. The number of doctors who are dirt dumb about the brain and how to treat and heal a wound to the brain is staggering. You can stop a convention of doctors with this slideshow that I just gave. We've been called every name in the book, and they haven't a clue about the science worldwide.
Rob, if you don't mind, I'd like to briefly answer the question about the VA. Why? I mean, about the FDA. Why haven't they approved this medicine for brain injuries? And I think I can succinctly answer it because I've written it. I've read your material as well. It has to do with the fact that HBOT is already a generic. It's out there. It's in thousands of hospitals and clinics. It's being used for other conditions, not brain injury, for which it's not specifically approved. That's still off-label. Well, to push a new drug or a new technology through the FDA process costs millions, tens of millions of dollars. You need multi-centered trials and so on. And frankly, who would do that? Why would any pharmaceutical company pay for it when at the end there would be no return on investment? Since everybody and his brother, there are dozens of manufacturers now. Rob mentioned some overseas. There's a lot in Israel where the work is done. They're in China, for crying out loud. So there is, briefly, there is no entity. Maybe Elon Musk or some billionaire, but no entity will pay for the extremely expensive process of FDA approval.
Joel,
And in
if
its
I may,
absence, it doesn't happen. Sure.
if I may, I agree with you up to the point where it is recognized all over the world. Israel, China, Russia, Germany, Britain, et cetera, wildly used. The European equivalent of our verifying system here approves it for 85 conditions, including traumatic brain injury. The FDA has all of the research it needs to approve it. We believe it's already on label because of what they've already approved. At the end of the day, the FDA has not been diligent in having on staff anyone who understands hyperbaric medicine. We have had meetings with people who cannot spell hyperbaric. 17, we had to educate them for 3 hours about what this medicine is. They don't accept that oxygen under pressure can do this. And so they're waiting on the #1 certifying agency, the Undersea and Hyperbaric Medical Society, which is gutless when it comes to making the case with the FDA. The research is so overwhelming. We have more research for traumatic brain injury than all of the research done for the 15 indications which are already on label. So there is a conspiracy of silence about this. Joel says we need 100,000 patients. We don't need 100,000 patients. The FDA itself wants to do Bayesian analysis, which is a way of learning from the first and the second and the third. We've got 31,000 examples of safety and efficacy. So some of us are hoping that a new roadblock will be cleared away when some real HBOT people are put in positions to organize a real scientific panel to say, have we proved this? Is it safe and effective? And CMS wants people over 65. Well, we have so much evidence, and they refused us because the clinical trials cut off at age 65. But worldwide, it's used. It's staggering how much evidence already exists. So I will make sure that the indications paper is there. You can read it. There's a conspiracy now to get HBOT as an alternative therapy. We have more and more support on Capitol Hill. We're hoping that we can turn it into a mandate. We're looking, if anybody out there in the insurance world wants to save a ton of money on car accidents, uninsured motorists, call me. We've got the trial already put together. You'll save a bunch of money, guaranteed.
Well, we appreciate your energy there. It's clearly palpable. I don't know, Joel, if you had any other questions you wanted to ask Rob?
I want to thank Rob again for a very enlightening and useful presentation. Thank him for his service to our country and to our veterans here. And thank him and the Treat Now team for mentoring us in New York State, because we have more than a fighting chance of getting a bill passed and funded this year to start a pilot program here in New York State for our wounded. So thank you.
Well, no further questions. I'm grateful for the opportunity to educate and inform, and I'm at anybody's service. Happy to help.
Okay.
Thank you, Brian.
Equally. I appreciate the time, Rob. I appreciate your time as well, Joel. Just remind everyone that we are recording the webinar. We'll send out a link as it gets uploaded on YouTube. And don't hesitate for anyone to visit treatnow.org or the bartfoundation.org as well.
Great. Thank you all.
Great. Good evening. Thank you.